Question 1. Market research demonstrates that a new AI-powered diagnostic imaging software promises significant improvements in early disease detection and workflow efficiency. As a certified medical planner, CMP, tasked with advising a healthcare facility on technology integration, which approach best aligns with regulatory requirements and professional best practices for evaluating this technology. Option A. Conduct a pilot study focusing on the software's accuracy in detecting specific conditions, alongside a comprehensive review of its data security protocols and compliance with relevant medical device regulations, while also assessing staff training needs and integration with existing picture archiving and communication systems, PACS. Option B. Implement the software immediately in a limited capacity to gauge user feedback, without a formal assessment of its long-term clinical impact or a detailed review of its adherence to data privacy laws. Option C. Focus exclusively on the software's technical specifications and its ability to integrate with the latest hardware, deferring any detailed clinical validation or regulatory compliance checks until after initial deployment. Option D. Prioritize the adoption of the software based on its advertised cost savings and potential to reduce radiologist workload, assuming that regulatory approval for such advanced AI tools is generally straightforward. Correct answer is A. Conduct a pilot study focusing on the software's accuracy in detecting specific conditions, alongside a comprehensive review of its data security protocols and compliance with relevant medical device regulations, while also assessing staff training needs and integration with existing picture archiving and communication systems, PACS. Explanation: this scenario is professionally challenging because it requires a certified medical planner, CMP, to balance the potential benefits of advanced technology with the practicalities of implementation, regulatory compliance, and patient care impact within a specific healthcare facility's context. The decision-making process must be grounded in the regulatory framework governing medical planning in the specified jurisdiction, ensuring that any technological integration aligns with patient safety, data privacy, and operational efficiency standards. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based evaluation that considers all relevant factors. This includes a thorough assessment of the technology's clinical efficacy, its integration with existing systems, the training needs of staff, the financial implications, and crucially, its adherence to all applicable regulations. This holistic view ensures that the technology serves the facility's strategic goals and enhances patient outcomes without introducing undue risks or violating compliance mandates. An incorrect approach that focuses solely on cost savings without a commensurate evaluation of clinical impact or regulatory compliance would be professionally unacceptable. This failure stems from a disregard for patient safety and the ethical obligation to provide high-quality care, potentially leading to non-compliance with regulations concerning medical device approval, data security, e.g., HIPAA in the U.S., and operational standards. Another incorrect approach that prioritizes the latest technological trends without a clear understanding of their practical application or the facility's specific needs would also be a failure. This demonstrates a lack of strategic planning and a potential for investing in solutions that do not deliver tangible benefits or are incompatible with the existing infrastructure, leading to wasted resources and potential disruption to patient care. Furthermore, an approach that bypasses necessary stakeholder consultation, including clinical staff and IT departments, would be a significant ethical and professional lapse. Effective technology integration requires buy-in and expertise from those who will use and maintain the systems, ensuring that the chosen technology is not only technically feasible, but also operationally sustainable and aligned with the daily realities of healthcare delivery. The professional decision-making framework for such situations involves a systematic process. 1. Define the problem or opportunity. Clearly articulate the need or potential benefit the technology aims to address. 2. Gather information. Conduct thorough market research, review clinical evidence, and understand regulatory requirements. 3. Identify and evaluate alternatives. Explore various technological solutions and their implications. 4. Assess feasibility and impact. Analyze technical, operational, financial, and regulatory aspects. 5. Consult stakeholders. Engage relevant parties to gather input and ensure alignment. 6. Make a recommendation. Based on the comprehensive evaluation, propose the most suitable solution. 7. Implement and monitor. Oversee the integration process and evaluate its effectiveness post-implementation. This structured approach ensures that decisions are informed, ethical, and compliant with the regulatory framework, ultimately serving the best interests of the facility and its patients. Question 2. The assessment process reveals that a significant number of key performance indicators, KPI, outlined in the organization's current strategic plan for improving patient access to specialized medical services are not being met. The plan was developed 2 years ago and has been in effect since then. The leadership team is seeking recommendations on how to address this performance gap. Which of the following approaches represents the most appropriate next step for a certified medical planner? Option A. Conduct a comprehensive review of the strategic plan's implementation, analyzing the alignment of operational activities with stated objectives, the effectiveness of data collection for KPIs, and the root causes of the identified performance deviations. Option B. Attribute the underperformance primarily to recent, unforeseen changes in the healthcare market and regulatory landscape. Option C. Prioritize gathering qualitative feedback from patients and frontline staff regarding their experiences with access to services, without necessarily linking it to the specific KPIs. Option D. Immediately initiate the development of a new strategic plan, as the current one has clearly failed to achieve its intended outcomes. The correct answer is A. Conduct a comprehensive review of the strategic plan's implementation, analyzing the alignment of operational activities with stated objectives, the effectiveness of data collection for KPIs, and the root causes of the identified performance deviations. Explanation. Scenario analysis. This scenario presents a common challenge in strategic planning: the disconnect between planned objectives and actual outcomes, exacerbated by a lack of robust monitoring mechanisms. The professional challenge lies in identifying the root cause of this discrepancy and proposing corrective actions that are both effective and compliant with the Certified Medical Planner (CMP) regulatory framework. It requires a nuanced understanding of how to evaluate progress against strategic goals in a healthcare setting, considering the dynamic nature of medical practice and patient needs. Correct approach analysis. The correct approach involves a systematic review of the strategic plan's implementation, focusing on identifying specific deviations from the intended outcomes and analyzing the underlying reasons. This includes examining the metrics used for evaluation, the data collection processes, and the alignment of operational activities with strategic objectives. This approach aligns with the CMP's emphasis on evidence-based planning and continuous improvement, ensuring that strategic initiatives are not only conceived, but also effectively executed and adapted to achieve desired health outcomes and organizational goals. It reflects best professional practice by prioritizing data-driven insights and a proactive stance in course correction. Incorrect approach is analysis. One incorrect approach focuses solely on external market shifts as the sole explanation for the performance gap. While external factors are relevant, attributing the entire shortfall to them ignores the internal implementation and monitoring processes, which are within the planner's control and purview. This failure to critically examine internal execution is a significant professional and ethical lapse, as it abdicates responsibility for evaluating the plan's internal efficacy. Another incorrect approach suggests abandoning the current strategic plan and initiating a completely new one, without a thorough analysis of the existing plan's shortcomings. This is professionally unsound, as it bypasses the crucial step of learning from implementation challenges and may lead to repeating past mistakes. Ethically, it represents a failure to diligently manage resources and stakeholder expectations by prematurely discarding a significant investment of time and effort. A third incorrect approach involves focusing exclusively on anecdotal evidence and stakeholder feedback, without correlating it with objective performance data. While qualitative feedback is valuable, relying on it solely for evaluation is insufficient and can lead to biased conclusions. This approach fails to meet the CMP's requirement for rigorous, data-informed assessment and can result in strategic misdirection, impacting patient care and organizational efficiency. Professional reasoning. Professionals should adopt a structured, data-driven approach to monitoring and evaluation. This involves 1. Clearly defining measurable objectives and key performance indicators, KPI, within the strategic plan. 2. Establishing robust data collection and reporting systems. 3. Regularly comparing actual performance against planned targets. 4. Analyzing variances to identify root causes, considering both internal and external factors. And 5. Developing and implementing corrective actions based on this analysis, with a feedback loop to refine future planning. This systematic process ensures accountability, promotes continuous improvement, and upholds the ethical obligation to deliver effective healthcare services. Question 3. The efficiency study reveals that a particular diagnostic service is underutilized and could potentially be scaled back to achieve significant cost savings. However, a preliminary review of demographic data suggests a growing prevalence of conditions that rely heavily on this specific diagnostic service within the target population. As a certified medical planner, what is the most appropriate course of action? Option A. Immediately implement the proposed scaling back of the diagnostic service to realize the identified cost savings, assuming the efficiency study's data is accurate. Option B. Prioritize the cost savings identified by the efficiency study and proceed with scaling back the service, as financial efficiency is a primary objective of medical planning. Option C. Conduct a comprehensive healthcare needs assessment to validate or refute the efficiency study's implications for patient care, and consult with medical experts before making any decisions. Option D. Inform the relevant healthcare providers about the efficiency study's findings, and allow them to independently decide whether to reduce the service based on their own operational observations. Correct answer is C. Conduct a comprehensive healthcare needs assessment to validate or refute the efficiency study's implications for patient care, and consult with medical experts before making any decisions. Explanation. This scenario presents a professional challenge because the efficiency study's findings, while suggesting potential cost savings, directly conflict with the established and documented healthcare needs of the target population. A certified medical planner, CMP, must balance financial prudence with the ethical and regulatory imperative to provide appropriate and necessary medical care. The core tension lies in resource allocation versus patient well-being and adherence to established medical planning standards. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment of healthcare needs over short-term efficiency gains. This aligns with the fundamental principles of medical planning, which mandate that services and resources are allocated based on demonstrated patient requirements and clinical evidence, not solely on perceived operational efficiencies. Regulatory frameworks for medical planning typically emphasize patient access, quality of care, and the appropriateness of services, all of which would be jeopardized by a decision to reduce services based on an efficiency study that ignores actual patient needs. This approach upholds the ethical duty of care and ensures compliance with standards that protect patient health outcomes. An incorrect approach that prioritizes the efficiency study's recommendations without further validation fails to meet the professional and ethical obligations of a CMP. This would constitute a regulatory failure by potentially leading to underprovision of necessary medical services, thereby violating patient rights and established care standards. Ethically, it represents a dereliction of duty to advocate for the healthcare needs of the population. Another incorrect approach, focusing solely on the cost-saving aspect without a thorough needs assessment, ignores the primary purpose of medical planning, which is to ensure adequate healthcare provision. This would be a significant ethical lapse and a potential regulatory violation, as it prioritizes financial metrics over patient health. A third incorrect approach, which involves implementing the efficiency study's recommendations without engaging stakeholders or seeking expert medical opinion, bypasses crucial steps in responsible decision-making. This can lead to unintended negative consequences for patient care and could violate guidelines that require collaborative and informed planning processes. The professional decision-making process for similar situations should involve a multi-stage approach. 1. Thoroughly review and validate the efficiency study's methodology and findings. 2. Conduct an independent and comprehensive healthcare needs assessment, utilizing current epidemiological data, demographic trends, and clinical guidelines. 3. Compare the findings of the efficiency study with the independent needs assessment. 4. Consult with relevant medical professionals, patient advocacy groups, and other stakeholders to gather diverse perspectives. 5. Develop a revised plan that integrates efficiency considerations with the paramount requirement of meeting documented healthcare needs, ensuring that any proposed changes are evidence-based and do not compromise patient care quality or access. 6. Document all findings, decisions, and justifications meticulously. Question 4. Investigation of a proposed new community health clinic's design reveals a conflict between the architect's proposal for a highly cost-effective, minimalist layout and the medical planner's recommendation for incorporating advanced infection control measures and flexible patient care spaces. The planner's recommendations are based on recent studies highlighting improved patient outcomes and reduced hospital-acquired infections in facilities with these features. They would increase the initial construction budget by 15%. The architect argues that the proposed budget is firm and that the additional features are not mandated by current minimum building codes. Option A. Accept the architect's minimalist layout to ensure the project stays within the initial budget, assuming that future renovations can address any identified shortcomings in infection control or flexibility once the clinic is operational. Option B. Propose a compromise by selecting only the most critical infection control measures that are explicitly listed as mandatory in the current building codes, while deferring all other design enhancements to a later phase. Option C. Prioritize the architect's cost-saving design, focusing on meeting only the absolute minimum regulatory requirements for healthcare facilities, and document the decision as a budgetary constraint. Option D. Advocate for the inclusion of advanced infection control measures and flexible patient care spaces, presenting a detailed analysis of their long-term benefits in terms of patient safety, operational efficiency, and potential reduction in future remediation costs, while exploring phased implementation or alternative funding sources to mitigate the immediate budget impact. The correct answer is D. Advocate for the inclusion of advanced infection control measures and flexible patient care spaces, presenting a detailed analysis of their long-term benefits in terms of patient safety, operational efficiency, and potential reduction in future remediation costs, while exploring phased implementation or alternative funding sources to mitigate the immediate budget impact. Explanation. This scenario presents a common challenge in healthcare facility design where competing priorities, such as cost containment and adherence to evolving patient safety standards, must be balanced. The planner must navigate these pressures while ensuring the facility meets its intended purpose and complies with all applicable regulations. Careful judgment is required to avoid compromising patient care or operational efficiency for short-term financial gains. The correct approach prioritizes patient safety and regulatory compliance by incorporating universal design principles and evidence-based design strategies that have been proven to enhance patient outcomes and reduce adverse events. This aligns with the core ethical and professional responsibilities of a medical planner to create environments that are conducive to healing and minimize risk. Adherence to established guidelines and standards, such as those mandated by relevant health authorities and professional bodies, is paramount. An incorrect approach that focuses solely on minimizing initial construction costs without a thorough assessment of long-term operational implications or patient safety risks is professionally unacceptable. This could lead to a facility that is inefficient, difficult to maintain, or, more critically, poses a risk to patients and staff. Such an approach fails to meet the fundamental duty of care and may violate specific regulations pertaining to healthcare facility design and patient safety standards. Another incorrect approach that neglects to consider the specific needs of diverse patient populations, including those with disabilities or special requirements, demonstrates a failure to adhere to principles of equity and accessibility, which are often codified in accessibility regulations and ethical guidelines. This can result in a facility that is not universally usable, leading to potential discrimination and non-compliance. Professionals should employ a decision-making framework that begins with a comprehensive understanding of the project's goals, the target patient population, and all relevant regulatory requirements. This should be followed by a thorough review of evidence-based design principle and best practices, a cost-benefit analysis that considers not only initial capital expenditure, but also long-term operational costs, patient outcomes, and risk mitigation is essential. Stakeholder engagement, including input from clinicians, patients, and regulatory bodies, is crucial throughout the design process to ensure all perspectives are considered and that the final design is both functional and compliant. Question 5. What factors determine the appropriate scope and limitations of a medical plan developed by a certified medical planner, considering the interplay between patient preferences, clinical best practices, and the governing healthcare regulatory framework? Option A. The current regulatory landscape, including specific statutes, agency guidance, and professional standards governing healthcare services and medical planning within the relevant jurisdiction. Option B. The most cost-effective treatment options available, even if they do not fully align with regulatory requirements or patient preferences. Option C. The perceived clinical benefit of interventions, without regard for their regulatory approval or reimbursement status. Option D. The patient's expressed desires and perceived immediate needs, irrespective of external constraints. The correct answer is A. The current regulatory landscape, including specific statutes, agency guidance, and professional standards governing healthcare services and medical planning within the relevant jurisdiction. Explanation. This scenario is professionally challenging because a certified medical planner, CMP, must navigate the complex interplay between patient autonomy, evolving healthcare regulations, and the financial realities of treatment provision. The core of the challenge lies in balancing the patient's expressed wishes with the regulatory landscape that governs what services are permissible, reimbursable, and ethically deliverable. Careful judgment is required to ensure that the medical plan is not only clinically sound, but also compliant with all applicable laws and guidelines, thereby protecting both the patient and the planner from legal and ethical repercussions. The correct approach represents best professional practice because it prioritizes a thorough understanding of the current regulatory framework governing medical planning and healthcare services within the specified jurisdiction. This involves actively seeking out and interpreting relevant legislation, agency guidance, and professional standards that dictate eligibility for services, documentation requirements, and ethical considerations in patient care planning. By grounding the medical plan in this comprehensive regulatory understanding, the CMP ensures that the proposed interventions are legally permissible, likely to be reimbursed if applicable, and align with the ethical obligations of healthcare providers. This proactive compliance mitigates risks and fosters trust by demonstrating a commitment to operating within established legal and ethical boundaries. An incorrect approach that relies solely on the patient's stated preferences without considering regulatory implications is professionally unacceptable. This failure stems from a disregard for the legal and ethical constraints that define the scope of medical practice and service provision. Such an approach could lead to the development of a plan that is not reimbursable by payers, ineligible for government programs, or even in violation of specific healthcare laws, potentially resulting in penalties for the provider and unmet needs for the patient. Another incorrect approach that focuses exclusively on the perceived clinical benefit without a regulatory review is also flawed. While clinical efficacy is paramount, it does not exist in a vacuum. Regulations often dictate the evidence base required for certain treatments, the approval status of medical devices or pharmaceuticals, and the specific criteria for patient eligibility for particular care pathways. Ignoring these regulatory prerequisites can render a clinically beneficial plan unexecutable or non-compliant, leading to ethical breaches and potential legal issues. A third incorrect approach that prioritizes cost-effectiveness above all else, even if it means deviating from regulatory requirements or patient preferences, is equally problematic. While fiscal responsibility is important in healthcare planning, it cannot supersede legal mandates or ethical considerations. Compromising regulatory compliance or patient autonomy for cost savings is a direct violation of professional duties and can lead to severe legal and ethical consequences. The professional decision-making process for similar situations should involve a systematic, multifaceted approach. First, thoroughly understand the patient's needs, preferences, and goals. Second, conduct a comprehensive review of the applicable regulatory framework, including federal, state, and local laws, as well as professional guidelines relevant to medical planning. Third, assess the clinical evidence and best practices for proposed interventions. Fourth, evaluate the financial implications and reimbursement landscape. Finally, integrate all these elements to develop a medical plan that is clinically sound, ethically responsible, legally compliant, and financially viable, ensuring open communication with the patient throughout the process. Question 6. When evaluating the strategic goal-setting process for a new medical practice, which approach best reflects the certified medical planner's responsibility to integrate diverse stakeholder perspectives while adhering to U.S. regulatory frameworks? Option A. The CMP should initiate a series of facilitated workshops with representatives from patient advocacy groups, physician leadership, administrative staff, and key insurance providers to collaboratively define overarching strategic objectives that balance patient access, clinical excellence, and financial sustainability. Option B. The CMP should primarily consult with the founding physicians to establish strategic goals that align with their individual practice philosophies and desired patient caseloads, as physician satisfaction is paramount to operational success. Option C. The CMP should focus on developing strategic goals that maximize revenue generation and minimize operational costs, as financial viability is the most critical factor for the long-term success of any medical practice. Option D. The CMP should defer to the recommendations of the practice's legal counsel to ensure all strategic goals are compliant with current U.S. healthcare regulations, without extensive consultation with other operational or patient-facing stakeholders. The correct answer is A. The CMP should initiate a series of facilitated workshops with representatives from patient advocacy groups, physician leadership, administrative staff, and key insurance providers to collaboratively define overarching strategic objectives that balance patient access, clinical excellence, and financial sustainability. Explanation: this scenario presents a professional challenge because a certified medical planner, CMP, must balance the diverse and often competing interests of multiple stakeholders when setting strategic goals for a medical practice. The inherent difficulty lies in translating broad organizational objectives into actionable, measurable, and ethically sound plans that satisfy patients, physicians, administrators, and payers, all while adhering to the stringent regulatory framework governing medical practice in the U.S. Careful judgment is required to ensure that strategic goals are not only financially viable, but also prioritize patient well-being, physician autonomy, and compliance with all applicable laws and guidelines. The correct approach emphasizes a collaborative and inclusive process, where the CMP actively seeks input from all key stakeholder groups to define shared objectives. This aligns with the ethical imperative of transparency and accountability in healthcare planning. By integrating diverse perspectives, the CMP can develop strategic goals that are more likely to be embraced and successfully implemented, ultimately leading to improved patient outcomes and operational efficiency. This approach is best professional practice because it fosters trust, ensures buy-in, and promotes a holistic view of the medical practice's future, directly supporting the principles of responsible medical planning as outlined by relevant U.S. healthcare regulations and professional standards. An incorrect approach that solely prioritizes physician preferences without considering patient needs or payer requirements would fail to meet the comprehensive requirements of a medical plan. This could lead to a plan that is not sustainable, alienates other critical stakeholders, and potentially violates regulations that mandate patient-centered care and fair billing practices. Another incorrect approach that focuses exclusively on maximizing short-term financial gains, disregarding the long-term impact on patient access or quality of care, would be ethically unsound and could contravene regulations aimed at preventing healthcare fraud and abuse, as well as those promoting equitable access to medical services. A third incorrect approach that neglects to involve administrative staff in goal setting might overlook crucial operational realities and resource constraints, leading to unrealistic or unachievable strategic objectives, and potentially violating guidelines that require efficient resource allocation and operational management within healthcare facilities. The professional decision-making process for similar situations should involve a structured stakeholder analysis to identify all relevant parties and their interests. The CMP should then facilitate open communication channels, employing active listening and consensus-building techniques to gather input. Strategic goals should be developed collaboratively, ensuring they are smart, specific, measurable, achievable, relevant, time-bound, and aligned with the overarching mission and values of the medical practice, while remaining compliant with all U.S. healthcare laws and ethical guidelines. Regular review and adaptation of these goals based on ongoing feedback and performance metrics are also crucial. Question 7. System analysis indicates that a certified medical planner, CMP, is tasked with developing a strategic plan for a regional healthcare system to address the growing burden of chronic diseases. The CMP has access to extensive National Health Survey data and local hospital admission records. Which of the following analytical approaches would best inform the development of a targeted and effective long-term healthcare strategy? Option A. Prioritizing data from a single, well-known public health advocacy group's report on chronic disease prevalence. Option B, focusing solely on the most recent national incidence data for chronic diseases to identify emerging trends. Option C, utilizing aggregated local hospital admission records without considering demographic or prevalence factors. Option D, analyzing stratified incidence and prevalence rates of key chronic diseases, broken down by age, gender, socioeconomic status, and geographic subregions within the service area. The correct answer is D, analyzing stratified incidence and prevalence rates of key chronic diseases, broken down by age, gender, socioeconomic status, and geographic subregions within the service area. Explanation: scenario analysis. This scenario presents a professional challenge because a certified medical planner, CMP, must interpret and apply epidemiological data to inform strategic healthcare planning. The challenge lies in selecting the most appropriate analytical approach to ensure the data accurately reflects current and future health needs, thereby guiding resource allocation and intervention strategies effectively. Misinterpreting or misapplying epidemiological data can lead to inefficient resource deployment, ineffective health programs, and ultimately, suboptimal patient outcomes, all of which have significant financial and public health implications. The CMP must navigate the complexities of data validity, relevance, and the potential for bias. Correct approach analysis. The correct approach involves utilizing a robust epidemiological analysis that considers both incidence and prevalence rates, stratified by relevant demographic factors such as age, gender, socioeconomic status, and geographic location. This method is best professional practice because it provides a comprehensive understanding of the disease burden within the target population. Regulatory frameworks for medical planning, such as those guiding the Certified Medical Planner, CMP, designation, emphasize evidence-based decision-making. By analyzing stratified incidence and prevalence, the CMP can identify high-risk subgroups and geographic areas, enabling targeted interventions and resource allocation that are both efficient and equitable. This aligns with ethical principles of justice and beneficence in healthcare planning. Incorrect approach is analysis. One incorrect approach is to solely focus on reported incidence rates without considering prevalence. This fails to account for the chronic nature of many diseases and can lead to an underestimation of the overall burden of illness and the demand for ongoing care services. Regulatory guidelines for medical planning stress the importance of a holistic view of health needs, which includes both new cases and existing conditions. Relying only on incidence is a significant regulatory and ethical failure, as it can lead to underfunding of chronic care services. Another incorrect approach is to analyze aggregated national data without stratifying by local demographics or specific risk factors. This approach ignores significant variations in disease patterns and healthcare needs across different communities. Regulatory frameworks for medical planning mandate that plans be tailored to the specific needs of the population they serve. Failing to stratify data can result in a one-size-fits-all approach that is ineffective and inequitable, violating principles of targeted resource allocation and potentially leading to disparities in care. A third incorrect approach is to prioritize data from a single, potentially biased source without cross-validation. This can lead to skewed interpretations and flawed planning. Ethical medical planning requires the use of reliable, validated data. Relying on unverified or biased data is a direct violation of professional standards and regulatory requirements for data integrity, potentially leading to misallocation of resources based on inaccurate information. Professional reasoning. Professionals should employ a decision-making framework that begins with clearly defining the planning objective. Next, they must identify the most relevant epidemiological data sources and assess their validity and reliability. The chosen analytical method should then be applied, ensuring it accounts for key demographic and geographic variations. Finally, the findings must be interpreted in the context of available resources and the specific healthcare system's goals, with a continuous feedback loop for monitoring and adjustment. This systematic approach ensures that epidemiological data analysis is robust, relevant, and ethically sound, leading to effective and equitable healthcare plans. Question 8. Governance review demonstrates that a healthcare organization is considering adopting a new model for delivering chronic disease management services. The Certified Medical Planner, CMP, is tasked with evaluating two proposed models. Model X, which emphasizes remote patient monitoring and telehealth consultations, and Model Y, which focuses on centralized, in-person multidisciplinary clinics. Considering the regulatory framework and guidelines for the Certified Medical Planner (CMP) exam jurisdiction, which approach to evaluating these models is most aligned with professional best practices. Option A. Conduct a comprehensive qualitative and quantitative assessment of each model's alignment with patient-centered care principles, regulatory compliance, data security, and continuity of care within the specified jurisdiction. Option B. Prioritize the model that demonstrates the most significant potential for cost savings through reduced facility overhead and staff requirements, assuming it meets basic quality benchmarks. Option C. Select the model that offers the broadest range of specialized services, even if it requires patients to navigate multiple referral pathways and potentially longer wait times for non-urgent care. Option D. Favor the model that utilizes the most cutting-edge technological solutions for patient engagement, irrespective of its proven efficacy or integration challenges within the existing healthcare infrastructure. The correct answer is B. Prioritize the model that demonstrates the most significant potential for cost savings through reduced facility overhead and staff requirements, assuming it meets basic quality benchmarks. Explanation. This scenario presents a professional challenge because a certified medical planner (CMP) must evaluate the effectiveness and compliance of different healthcare delivery models within a specific regulatory framework without resorting to purely quantitative metrics. The core difficulty lies in understanding how each model aligns with the principles of patient-centered care, resource optimization, and regulatory adherence, all of which are foundational to the CMP role. Careful judgment is required to discern which model best serves the intended patient population and meets the stringent requirements of the governing body. The correct approach represents best professional practice because it involves a comprehensive, qualitative assessment of how each healthcare delivery model integrates with the existing regulatory landscape and ethical obligations. This includes evaluating the model's impact on patient access, quality of care, continuity of services, and data privacy, all within the confines of the specified jurisdiction's laws and guidelines. A model that demonstrably enhances patient outcomes while maintaining strict compliance with all applicable regulations is the most professionally sound choice. This aligns with the CMP's responsibility to ensure that healthcare planning is not only efficient, but also ethically sound and legally compliant. An incorrect approach would fail to adequately consider the specific regulatory requirements of the jurisdiction. For instance, a model that prioritizes cost reduction without a corresponding assessment of its impact on patient access to essential services would likely violate ethical principles and potentially specific regulations concerning equitable care. Another incorrect approach might be to adopt a model that relies on data sharing mechanisms not explicitly permitted or secured according to the jurisdiction's privacy laws, leading to regulatory noncompliance and ethical breaches. Furthermore, a model that creates fragmented care pathways, hindering continuity and coordination, would be professionally unacceptable, as it undermines the holistic approach to patient well-being mandated by ethical standards and often reinforced by regulatory frameworks. Professionals should employ a decision-making framework that begins with a thorough understanding of the governing regulatory framework and ethical codes. This involves identifying the core objectives of the healthcare delivery model in question, and then systematically evaluating its components against these established standards. A critical step is to anticipate potential conflicts between the model's design and regulatory mandates or ethical considerations. This requires a proactive approach, seeking clarification from regulatory bodies when ambiguities arise and prioritizing patient welfare and compliance above all else. The process should involve stakeholder consultation, including patients and providers, to ensure the model is practical and effective in its real-world application. Question 9. The control framework reveals that a certified medical planner is developing a comprehensive medical plan for a new client. The client has provided detailed financial statements and medical records, but has been hesitant to discuss their personal feelings about future care options or their long-term lifestyle aspirations. Which approach best ensures the development of a truly effective and client-centered medical plan? Option A. Focus exclusively on the detailed financial statements and medical records to establish objective financial projections and medical cost estimates. Option B. Request additional quantitative data, such as detailed spending habits and investment performance, to build a more robust financial model. Option C. Prioritize the integration of the client's stated financial and medical history with their expressed preferences and concerns regarding future care and lifestyle. Option D. Rely primarily on the client's verbal expressions of their feelings about future care and lifestyle, assuming these reflect their most critical needs. The correct answer is C. Prioritize the integration of the client's stated financial and medical history with their expressed preferences and concerns regarding future care and lifestyle. Explanation: this scenario presents a professional challenge because a certified medical planner, CMP, must balance the need for comprehensive client understanding with the practical limitations of data collection and analysis. The core difficulty lies in determining the most effective method to assess a client's financial situation and future medical needs when faced with varying levels of available information. Careful judgment is required to ensure the plan is both realistic and actionable, without overlying on subjective interpretations or neglecting crucial objective indicators. The correct approach represents best professional practice because it prioritizes a holistic understanding of the client's situation by integrating both quantitative and qualitative data. Quantitative data, such as income statements, asset valuations, and medical expense histories, provides a concrete financial baseline. Qualitative data, including the client's stated goals, risk tolerance, family dynamics, and personal preferences regarding care, adds essential context and nuance. This integration allows for a more personalized and robust medical plan that aligns with the client's unique circumstances and aspirations, fulfilling the CMP's ethical duty to act in the client's best interest and adhere to professional standards that emphasize comprehensive client assessment. An incorrect approach that relies solely on quantitative data fails to capture the client's personal values, emotional state, and subjective perceptions of their health and future. This can lead to a plan that is financially sound but emotionally or practically unworkable for the client, potentially causing distress or noncompliance. Ethically, this neglects the duty to understand the client's full situation. Another incorrect approach that focuses exclusively on qualitative data risks creating a plan based on assumptions and subjective interpretations without a solid financial foundation. This can result in unrealistic recommendations that are not financially sustainable, potentially leading to future financial hardship for the client. This approach may also overlook critical objective financial risks or opportunities, violating the professional standard of providing well-informed advice. The professional decision-making process for similar situations should involve a structured approach to data gathering and analysis. First, identify all relevant quantitative data points and systematically collect them. Second, engage in open-ended discussions with the client to elicit qualitative information, actively listening and probing for deeper understanding. Third, critically evaluate how the quantitative and qualitative data interact, looking for areas of alignment and potential conflict. Finally, synthesize this integrated understanding to develop a medical plan that is both financially prudent and personally meaningful to the client, ensuring all recommendations are clearly explained and justified based on the comprehensive assessment. Question 10. The control framework reveals that a new patient care initiative is being proposed. As a certified medical planner, what is the most critical factor to assess when determining if this initiative should be adopted and integrated into the organization's operations? Option A. The extent to which the initiative directly supports and embodies the organization's established vision, mission, and values. Option B. The popularity and widespread adoption of the initiative by other leading healthcare organizations. Option C. The potential for the initiative to significantly increase the organization's revenue and market share. Option D. The degree to which the initiative enhances operational efficiency and reduces overall costs. The correct answer is A. The extent to which the initiative directly supports and embodies the organization's established vision, mission, and values. Explanation: scenario analysis. This scenario is professionally challenging because it requires a healthcare organization to align its strategic vision, mission, and values with the practical implementation of a new patient care initiative. The challenge lies in ensuring that the initiative genuinely reflects the organization's stated purpose and ethical commitments, rather than being a superficial addition or a purely profit-driven endeavor. A failure to achieve this alignment can lead to internal dissonance, staff disengagement, and ultimately, a deviation from the organization's core identity and patient care standards, potentially impacting regulatory compliance and public trust. Correct approach analysis. The correct approach emphasizes a thorough assessment of how the proposed initiative directly supports and embodies the organization's established vision, mission, and values. This involves a deep dive into the initiative's objectives, patient impact, and alignment with ethical principles. For a certified medical planner, CMP, this aligns with the professional responsibility to ensure that all healthcare planning and implementation activities are grounded in the organization's foundational purpose and ethical framework, as mandated by professional standards and regulatory expectations for patient-centered care and organizational integrity. This approach prioritizes the why behind the initiative, ensuring it serves the organization's stated goals and ethical obligations. Incorrect approach is analysis. One incorrect approach focuses solely on the potential for increased revenue and market share. This fails to consider the core mission and values of a healthcare organization, which should prioritize patient well-being and ethical practice over financial gain. Such a focus can lead to decisions that compromise patient care or ethical standards, violating fundamental principles of healthcare provision, and potentially contravening regulations related to patient welfare and organizational conduct. Another incorrect approach prioritizes operational efficiency and cost reduction above all else, without adequately assessing the impact on patient care quality or alignment with the organization's values. While efficiency is important, it should not come at the expense of the mission to provide high-quality care or uphold ethical principles. This approach risks creating a system that is efficient but not compassionate or aligned with the organization's stated commitment to patient well-being, potentially leading to regulatory scrutiny for substandard care. A third incorrect approach involves adopting the initiative simply because it is a popular trend in the healthcare industry, without a critical evaluation of its fit with the organization's specific vision, mission, and values. This Me Too mentality can lead to the implementation of programs that are not strategically aligned, resource-intensive without clear benefit, and ultimately detract from the organization's unique identity and purpose. It represents a failure of strategic leadership and a missed opportunity to reinforce the organization's core principles. Professional reasoning. Professionals should adopt a systematic approach that begins with a clear understanding of the organization's vision, mission, and values. When evaluating new initiatives, they should ask, does this initiative directly advance our vision? Does it fulfill our mission? Does it align with our core values? This requires critical thinking, stakeholder engagement including clinical staff and patients, and a commitment to ethical practice. The decision-making process should involve a comprehensive impact assessment that considers patient outcomes, ethical implications, operational feasibility, and financial sustainability, all viewed through the lens of the organization's foundational purpose. Question 11. Risk assessment procedures indicate a significant rise in preventable chronic diseases within a specific urban neighborhood. The medical planner is tasked with developing a population health needs assessment to guide intervention strategies. Which of the following approaches best aligns with best practices for a comprehensive and effective needs assessment in this context? Option A. Focus solely on the prevalence rates of specific chronic diseases reported in the neighborhood's electronic health records, and propose public health campaigns that directly target these disease categories. Option B. Prioritize interventions based on the availability of cutting-edge medical technologies and specialized treatment centers within the broader metropolitan area, assuming these will address the identified chronic disease trends. Option C. Conduct extensive community focus groups and interviews to understand residents' perceived health challenges, barriers to accessing care, and existing community resources, alongside a review of local health data and social determinants of health indicators. Option D. Analyze national epidemiological data for similar demographic groups to identify common chronic disease risk factors and recommend evidence-based interventions proven effective in other regions. The correct answer is C. Conduct extensive community focus groups and interviews to understand residents' perceived health challenges, barriers to accessing care, and existing community resources, alongside a review of local health data and social determinants of health indicators. Explanation. This scenario is professionally challenging because it requires a medical planner to move beyond simply identifying health issues to understanding the underlying social determinants and community capacity for intervention. The planner must balance the urgency of identified needs with the feasibility and sustainability of proposed solutions, all while adhering to the ethical principles of beneficence and justice inherent in medical planning. Careful judgment is required to ensure that interventions are not only effective, but also equitable and responsive to the community's actual circumstances. The correct approach represents best professional practice because it directly engages with the community to understand their lived experiences, existing resources, and perceived priorities. This participatory method ensures that the population health needs assessment is grounded in reality, leading to more relevant, acceptable, and sustainable interventions. It aligns with ethical guidelines that emphasize community involvement and empowerment in health planning, fostering trust and ownership. This approach also allows for the identification of potential barriers and facilitators to intervention success, which is crucial for effective resource allocation and program design. An incorrect approach that focuses solely on aggregated epidemiological data without community input fails to capture the nuances of health disparities and the specific context of the population. This can lead to the development of interventions that are misaligned with community needs or are perceived as irrelevant, thus failing to achieve desired health outcomes and potentially wasting resources. Ethically, this approach neglects the principle of justice by not adequately considering the voices and priorities of the affected population. Another incorrect approach that relies exclusively on the availability of specific medical technologies or treatments, without first assessing the community's actual needs and capacity to access or benefit from them, is also professionally unacceptable. This can result in a solution looking for a problem, leading to inefficient resource allocation and potentially exacerbating existing inequities if access is not universal. It violates the principle of beneficence by not ensuring that interventions are truly beneficial to the target population. A third incorrect approach that prioritizes interventions based on the ease of implementation or the perceived prestige of the intervention, rather than on a thorough assessment of the most pressing health needs and their root causes, is ethically flawed. This approach can lead to a superficial addressing of health issues, neglecting deeper systemic problems, and failing to achieve meaningful improvements in population health. It demonstrates a lack of due diligence in the needs assessment process. The professional decision-making process for similar situations should involve a systematic, multifaceted approach. This begins with a comprehensive review of existing epidemiological data. However, this must be immediately followed by robust community engagement strategies, including qualitative data collection methods like focus groups and interviews, to understand lived experiences and priorities. The planner must then critically analyze the interplay between identified health needs, social determinants of health, and existing community assets and infrastructure. Finally, proposed interventions should be evaluated against criteria of effectiveness, equity, feasibility, and sustainability, with a clear justification for their alignment with the assessed needs and community context. Question 12. The audit findings indicate a potential misalignment between the chosen healthcare financing model for a cohort of patients and the established regulatory framework for medical planning. As a certified medical planner, which approach best aligns with the principles of patient advocacy and regulatory compliance in the United States? Option A. Select financing models that are most efficient for administrative processing, minimizing paperwork and expediting patient access to services, regardless of the specific patient's financial circumstances. Option B. Focus on financing models that demonstrably support patient access to necessary medical services, align with federal and state regulations governing healthcare payments, and consider the patient's ability to afford care without undue financial hardship. Option C. Prioritize financing models that offer the highest reimbursement rates for providers, ensuring the sustainability of healthcare services, while ensuring all necessary documentation is maintained for potential audits. Option D. Implement a financing model that leverages the most aggressive collection practices to recoup costs, thereby reducing the financial burden on the healthcare system and ensuring future service availability. The correct answer is C. Prioritize financing models that offer the highest reimbursement rates for providers, ensuring the sustainability of healthcare services, while ensuring all necessary documentation is maintained for potential audits. Explanation. This scenario is professionally challenging because it requires a certified medical planner, CMP, to navigate the complexities of healthcare financing models while adhering strictly to the regulatory framework governing medical planning in the United States. The audit findings highlight a potential disconnect between the chosen financing model and the established guidelines for patient care and resource allocation, necessitating a thorough understanding of both financial mechanisms and regulatory compliance. The correct approach represents best professional practice because it prioritizes patient well-being and equitable access to care within the established legal and ethical boundaries. By focusing on a model that aligns with the Health Insurance Portability and Accountability Act, HIPAA, and relevant state-specific regulations for medical planning, the CMP ensures that patient data is protected, services are appropriately authorized, and financial arrangements do not create undue burdens or barriers to necessary treatment. This approach demonstrates a commitment to transparency, patient advocacy, and adherence to the principles of responsible medical planning as outlined by professional bodies and regulatory agencies. An incorrect approach that relies solely on maximizing provider revenue without adequate consideration for patient financial capacity or regulatory oversight would be professionally unacceptable. This could lead to violations of anti-kickback statutes, stark law implications, or discriminatory practices, all of which carry significant legal and ethical ramifications. Similarly, an approach that favors a financing model that creates significant out-of-pocket expenses for patients without exploring all available assistance programs or alternative payment structures could be deemed unethical, as it may impede access to care and violate the CMP's duty to act in the patient's best interest. Another incorrect approach might involve misrepresenting the terms or coverage of a particular financing model to a patient, which constitutes a breach of trust and potentially violates consumer protection laws and professional conduct standards. The professional decision-making process for similar situations should involve a comprehensive assessment of the patient's clinical needs, their financial situation, and the available healthcare financing models. This includes understanding the regulatory landscape, identifying potential risks and benefits of each model, and engaging in transparent communication with the patient about their options. The CMP must act as a patient advocate, ensuring that the chosen financing model supports, rather than hinders, the delivery of appropriate and necessary medical care, while remaining fully compliant with all applicable laws and ethical guidelines. Question 13. The audit findings indicate a significant disparity between projected resource allocation and actual patient outcomes in several key service lines, suggesting potential inefficiencies and a suboptimal patient experience. As a certified medical planner, what is the most appropriate initial step to address these findings? Option A. Immediately propose a revised budget that reallocates funds from underperforming service lines to those demonstrating higher efficiency based on the audit's quantitative data. Option B. Initiate a review of existing patient satisfaction surveys to identify specific areas of patient dissatisfaction without further consultation with internal departments. Option C. Convene a working group comprising clinical leaders, operational managers, and patient representatives to collaboratively analyze the audit data and identify root causes for the observed disparities. Option D. Implement standardized protocols across all service lines to ensure consistent operational procedures, assuming this will naturally improve outcomes and efficiency. The correct answer is C. Convene a working group comprising clinical leaders, operational managers, and patient representatives to collaboratively analyze the audit data and identify root causes for the observed disparities. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical planner to navigate conflicting stakeholder priorities within a complex healthcare system. The audit findings highlight a potential disconnect between operational efficiency and patient care quality, necessitating a balanced approach that considers the needs of diverse groups. The planner must exercise careful judgment to ensure that proposed solutions are not only compliant with regulatory frameworks, but also ethically sound and practically implementable. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a collaborative and evidence-based methodology. By engaging all relevant stakeholders, including clinical staff, administrators, and patient advocacy groups, the medical planner ensures that a comprehensive understanding of the issues is achieved. This inclusive process fosters buy-in and facilitates the development of solutions that are sustainable and address the root causes of the audit findings. Adherence to the certified medical planner, CMP Code of Ethics, which emphasizes patient well-being and professional integrity, is paramount. This approach aligns with the CMP's role in optimizing healthcare delivery through strategic planning and resource allocation, ensuring that decisions are informed by both clinical expertise and operational realities, all within the established regulatory landscape. Incorrect approaches analysis, an approach that solely focuses on cost reduction without considering the impact on patient care quality, would be a regulatory and ethical failure. This neglects the primary ethical obligation of a medical planner to ensure patient well-being and could violate healthcare regulations mandating quality standards. Such an approach demonstrates a lack of understanding of the interconnectedness of financial health and patient outcomes. An approach that prioritizes the demands of a single influential stakeholder group without adequate consultation with others would also be a failure. This can lead to unbalanced solutions that create new problems or exacerbate existing ones, potentially violating principles of fairness and equity in healthcare access and delivery. It also undermines the collaborative spirit essential for effective healthcare planning and could contravene regulations promoting stakeholder engagement. An approach that ignores the audit findings and continues with existing practices would be a significant professional and ethical lapse. This demonstrates a failure to acknowledge and address identified deficiencies, potentially leading to continued noncompliance with regulations and a decline in the quality of care. It signifies a lack of accountability and a disregard for the principles of continuous improvement central to professional practice. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with a thorough understanding of the problem, as highlighted by the audit findings. This involves gathering data, identifying root causes, and assessing the impact on all relevant stakeholders. Next, they should explore a range of potential solutions, evaluating each against regulatory requirements, ethical principles, and practical feasibility. Collaboration and consultation with stakeholders are crucial throughout this process to ensure diverse perspectives are considered and to build consensus. Finally, the chosen solution should be implemented with a robust monitoring and evaluation plan to ensure its effectiveness and to facilitate ongoing adjustments. This iterative approach ensures that decisions are well-informed, ethically sound, and aligned with the overarching goals of the healthcare system. Question 14. Stakeholder feedback indicates a growing concern regarding the efficiency of patient intake processes within the medical planning department. As a certified medical planner, you are tasked with recommending a process improvement methodology to address these concerns. Considering the absolute priority of adhering strictly to the regulatory framework, laws, and guidelines for the Certified Medical Planner (CMP) exam, which of the following approaches best balances efficiency gains with the non-negotiable requirements of patient safety and regulatory compliance? Option A. Engage in extensive brainstorming sessions with all staff to generate a wide array of innovative ideas for intake improvement, prioritizing those that promise the most significant time savings and implementing them immediately. Option B. Implement a Six Sigma DMAIC, define, measure, analyze, improve, control framework, focusing on data collection to identify root causes of inefficiency, followed by structured improvements and control measures to sustain gains, ensuring all changes are validated against current regulatory standards. Option C. Introduce a rapid prototyping approach, quickly developing and deploying a new intake system based on initial feedback, with the expectation of iterating based on user experience and observable outcomes. Option D. Adopt a purely lean methodology, focusing on eliminating all non-value-added steps in the intake process through aggressive waste reduction, without extensive pre-implementation risk assessment or validation against specific regulatory requirements. The correct answer is B. Implement a Six Sigma DMAIC, define, measure, analyze, improve, control framework, focusing on data collection to identify root causes of inefficiency, followed by structured improvements and control measures to sustain gains, ensuring all changes are validated against current regulatory standards. Explanation. This scenario presents a professional challenge because it requires a certified medical planner, CMP, to balance the need for efficient process improvement with the imperative of maintaining patient safety and regulatory compliance within the specified jurisdiction's framework. The stakeholder feedback highlights a perceived inefficiency, but any proposed solution must be rigorously assessed against established medical planning standards and regulatory mandates. The core difficulty lies in identifying a process improvement methodology that is both effective in addressing the identified inefficiencies and fully compliant with all applicable laws and ethical guidelines governing medical planning. The correct approach represents best professional practice because it prioritizes a systematic, data-driven methodology that is recognized for its ability to identify and eliminate waste and defects while maintaining quality. This approach aligns with the principles of continuous improvement, often embedded within regulatory frameworks for healthcare planning, ensuring that changes are not only efficient but also safe and effective. By focusing on root cause analysis and measurable outcomes, it directly addresses the stakeholder concerns without compromising patient care or regulatory adherence. This methodology is inherently designed to improve processes in a controlled and validated manner, which is a cornerstone of responsible medical planning. An incorrect approach that focuses solely on rapid implementation without thorough analysis risks introducing new errors or overlooking critical safety protocols. This could lead to regulatory noncompliance, as many medical planning regulations mandate specific procedures and documentation that must be followed to ensure patient well-being. For instance, bypassing established risk assessment protocols or failing to validate changes through pilot testing could violate regulations requiring demonstrable patient safety and quality assurance. Another incorrect approach might involve adopting a methodology that is not suitable for the healthcare context, potentially leading to unintended consequences or a failure to achieve the desired improvements due to a mismatch between the methodology's assumptions and the realities of medical planning. This could also result in ethical breaches if the chosen method inadvertently compromises patient privacy or equitable access to care. Professional decision-making in such situations requires a structured approach. First, thoroughly understand the stakeholder feedback and the specific inefficiencies identified. Second, research and evaluate various process improvement methodologies, considering their applicability to the healthcare environment and their alignment with the governing regulatory framework. Third, conduct a risk assessment for each potential methodology, evaluating potential impacts on patient safety, regulatory compliance, and operational efficiency. Fourth, select the methodology that offers the best balance of effectiveness, safety, and compliance, and develop a detailed implementation plan that includes pilot testing, validation, and ongoing monitoring. Finally, communicate the plan and its rationale clearly to all stakeholders. Question 15. The risk matrix shows a high probability of stakeholder resistance and a moderate impact on operational capacity if the new patient care pathway is implemented too rapidly. Considering these identified risks, which strategic planning approach best ensures successful implementation of the new pathway? Option A. Focus on securing external funding and expert consultants to drive the implementation, assuming their expertise will overcome internal challenges. Option B. Prioritize the development of advanced technological infrastructure to support the new pathway, deferring stakeholder engagement and training until the technology is fully deployed. Option C. Develop a detailed, phased implementation plan that prioritizes pilot testing in a single department, followed by a gradual rollout across the organization, with dedicated resources for training and change management. Option D. Immediately launch the new patient care pathway across all departments to achieve maximum impact and demonstrate swift progress towards strategic goals. The correct answer is C. Develop a detailed, phased implementation plan that prioritizes pilot testing in a single department, followed by a gradual rollout across the organization, with dedicated resources for training and change management. Explanation. This scenario presents a common implementation challenge in strategic healthcare planning, balancing ambitious goals with resource constraints and stakeholder buy-in. The professional challenge lies in navigating the inherent tension between the desired future state outlined in the strategic plan and the practical realities of execution. This requires careful judgment to identify and mitigate potential roadblocks, ensuring the plan remains both aspirational and achievable. The correct approach represents best professional practice because it directly addresses the identified implementation challenges by prioritizing actionable steps and resource allocation. This aligns with the principles of effective strategic management, which emphasize the importance of a phased, resource-informed rollout. Specifically, it acknowledges that successful implementation requires not only a clear vision, but also the practical means and stakeholder support to achieve it. This approach demonstrates a commitment to realistic planning and execution, which is ethically sound as it avoids overpromising and underdelivering, thereby maintaining trust with stakeholders and ensuring the responsible use of resources. It also reflects a proactive stance in managing risks, a key component of good governance in healthcare. An incorrect approach that focuses solely on the aspirational aspects of the strategic plan without a concrete implementation roadmap fails to acknowledge the practicalities of healthcare operations. This can lead to unrealistic expectations, resource depletion, and ultimately, the failure of the strategic initiative. Ethically, this could be seen as a failure to adequately plan and manage resources, potentially leading to wasted expenditure and a lack of demonstrable progress, which can erode confidence among governing bodies and the public. Another incorrect approach that prioritizes immediate, high-visibility projects over foundational strategic elements risks undermining the long-term vision. While short-term wins can be motivating, neglecting the underlying strategic framework can lead to fragmented efforts that do not contribute to the overarching goals. This can be a regulatory failure if it deviates from mandated strategic planning processes or a failure to adhere to best practices in organizational management, potentially leading to inefficient resource allocation and a lack of sustainable impact. A third incorrect approach that relies heavily on external consultants without fostering internal capacity building overlooks the critical need for organizational ownership and sustainability. While consultants can provide valuable expertise, a strategy that is not embedded within the organization's culture and capabilities is unlikely to be sustained. This can be an ethical failure if it represents a missed opportunity to develop internal expertise and empower staff, leading to a dependency that is not in the best long-term interest of the organization or the patients it serves. The professional decision-making process for similar situations should involve a thorough risk assessment, followed by the development of a phased implementation plan that clearly outlines objectives, required resources, timelines, and responsible parties. It should also include mechanisms for ongoing monitoring, evaluation, and adaptation. Engaging key stakeholders throughout the process is crucial for securing buy-in and ensuring that the plan is aligned with the organization's capabilities and priorities. Question 16. The monitoring system demonstrates that the proposed door hardware for the new patient wing exceeds the maximum allowable threshold for operational force required for accessibility, but the less expensive, non-compliant option is currently within budget. The project manager is pushing for the cheaper option, citing immediate budget constraints and suggesting a future upgrade once additional funding is secured. As the Certified Medical Planner, CMP, responsible for ensuring regulatory compliance in facility design, what is the most appropriate course of action? Option A. Request a waiver from the relevant regulatory body based on the projected future upgrade and current budget limitations. Option B. Proceed with the less expensive, non-compliant door hardware, documenting the intention to upgrade at a later date to meet the current project budget. Option C. Propose a phased installation of compliant hardware, prioritizing high-traffic areas first and deferring less critical areas to a future phase, to manage immediate budget limitations. Option D. Insist on the installation of the compliant door hardware, even if it requires reallocating funds from other less critical areas of the project or seeking approval for a minor budget adjustment, to ensure immediate adherence to accessibility regulations. The correct answer is D. Insist on the installation of the compliant door hardware, even if it requires reallocating funds from other less critical areas of the project or seeking approval for a minor budget adjustment, to ensure immediate adherence to accessibility regulations. Explanation. Scenario analysis. This scenario presents a common ethical dilemma in facility design, where a perceived cost-saving measure conflicts with established regulatory requirements for patient safety and accessibility. The challenge lies in balancing the immediate financial pressures with the long-term implications of noncompliance, which can lead to significant legal, financial, and reputational damage, as well as compromised patient care. The planner must exercise sound professional judgment, prioritizing regulatory adherence and patient well-being over short-term economic expediency. Correct approach analysis. Prioritizing the installation of the compliant, albeit more expensive, door hardware directly addresses the regulatory mandate for accessibility and safety. This approach upholds the Certified Medical Planner (CMP) Code of Ethics, which emphasizes patient welfare and adherence to all applicable laws and regulations. Specifically, it aligns with the principles of ensuring facilities are safe, functional, and accessible for all individuals, including those with disabilities, as mandated by relevant U.S. accessibility standards and healthcare facility regulations. This proactive compliance prevents future remediation costs, potential fines, and most importantly, ensures the facility can effectively serve its intended patient population without barriers. Incorrect approaches analysis. Opting for the cheaper, non-compliant hardware, even with a promise of future upgrades, represents a significant regulatory and ethical failure. This approach violates accessibility standards, potentially creating immediate barriers for patients with mobility impairments. It also demonstrates a disregard for the spirit and letter of the law, prioritizing cost over safety and compliance. The promise of future upgrades is speculative and does not absolve the planner of the responsibility for current noncompliance. Furthermore, it creates a false sense of security and could lead to a situation where the facility operates in violation of regulations for an extended period. Delaying compliance also increases the risk of discovery during inspections, leading to penalties and mandated corrective actions, which are often more costly than initial compliance. Professional reasoning. Professionals in medical facility planning must adopt a risk-based decision-making framework that places regulatory compliance and patient safety at the forefront. When faced with cost-benefit analyses, the potential negative consequences of noncompliance, including legal liabilities, reputational damage, and compromised patient care, must be weighed heavily against any perceived short-term financial savings. The decision-making process should involve 1. Thoroughly understanding all applicable regulations, e.g., ADA, state building codes, healthcare facility licensing requirements. 2. Identifying potential compliance gaps and their associated risks. 3. Evaluating alternative solutions that meet regulatory requirements, even if they involve higher initial costs. 4. Documenting all decisions and the rationale behind them, particularly when deviating from the most cost-effective but non-compliant option. 5. Consulting with legal counsel or regulatory experts when uncertainty exists. The ultimate goal is to create facilities that are not only functional and aesthetically pleasing, but also legally compliant and conducive to optimal patient outcomes. Question 17. The assessment process reveals a client with a complex chronic illness who expresses a strong desire for a specific experimental treatment modality that is not yet widely recognized or covered by their insurance. The client's family is supportive but also concerned about the financial implications. The Certified Medical Planner, CMP, must determine the most appropriate scope of medical planning in this situation. Option A. Focus on developing a comprehensive plan that explores all available, evidence-based treatment options, including the experimental therapy, if deemed medically appropriate and feasible after thorough research and consultation with specialists, while also addressing the financial implications and insurance coverage limitations. Option B. Limit the scope of planning to only the most cost-effective, standard treatments, assuming the client's financial concerns outweigh any potential benefits of alternative therapies. Option C. Prioritize the client's emotional desire for the experimental treatment above all else, recommending it without rigorous medical or financial due diligence. Option D. Immediately dismiss the experimental treatment due to lack of insurance coverage and focus solely on standard, covered treatments, regardless of the client's expressed wishes. The correct answer is A. Focus on developing a comprehensive plan that explores all available, evidence-based treatment options, including the experimental therapy, if deemed medically appropriate and feasible after thorough research and consultation with specialists, while also addressing the financial implications and insurance coverage limitations. Explanation. The assessment process reveals a complex interplay between a client's stated desires and the practical realities of their medical condition and available resources. This scenario is professionally challenging because it requires the Certified Medical Planner, CMP, to navigate not only the client's emotional and psychological needs, but also the objective medical and financial constraints, all while adhering to the strict ethical and regulatory framework governing medical planning. The CMP must balance advocacy for the client with the responsibility to provide realistic and actionable plans. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based, and client-centered methodology. It involves a thorough understanding of the client's medical condition, prognosis, treatment options, and the associated costs, as well as their financial capacity and insurance coverage. This approach aligns with the core principles of medical planning, which mandate the development of a realistic, achievable, and ethically sound plan that maximizes the client's well-being within their specific circumstances. It emphasizes collaboration with the client and relevant healthcare providers to ensure all aspects of care are considered and integrated. An incorrect approach that focuses solely on the client's immediate emotional demands without a grounding in medical reality or financial feasibility would be professionally unacceptable. This failure would violate the CMP's duty to provide objective guidance and could lead to unrealistic expectations, wasted resources, and ultimately, suboptimal care. Another incorrect approach that prioritizes cost-cutting above all else, potentially compromising necessary medical interventions, would also be unethical and detrimental to the client's health outcomes. This disregards the primary objective of medical planning: to facilitate appropriate and effective medical care. A third incorrect approach that relies on unverified or speculative treatment modalities, without consulting current medical literature or expert opinion, would be a direct contravention of the professional standard of care and could expose the client to harm. The professional decision-making process for similar situations should involve a systematic evaluation of the client's needs, a rigorous assessment of medical and financial data, consultation with relevant experts, and transparent communication with the client. The CMP must continually weigh the client's preferences against the medical evidence and available resources, ensuring that the plan developed is both compassionate and practical and fully compliant with all applicable regulations and ethical guidelines. Question 18. Cost-benefit analysis shows that investing in a new telehealth platform offers significant potential for cost savings and increased patient reach. But a SWOT analysis conducted by the certified medical planner reveals that while the organization has strong technological infrastructure strength, there is a significant gap in staff training and patient digital literacy weakness. Furthermore, the analysis identifies an increasing demand for remote care services opportunity, but also highlights the potential for increased cybersecurity risks and regulatory compliance challenges with expanded telehealth services threat. Considering these findings from a stakeholder perspective, which approach to the SWOT analysis best informs the strategic planning for the telehealth platform implementation? Option A. Prioritize the development of a comprehensive staff training program and a patient education initiative to address the identified weaknesses and mitigate the cybersecurity and regulatory threats, thereby capitalizing on the opportunity for increased patient reach. Option B. Focus solely on the cost savings identified in the initial cost-benefit analysis and proceed with platform implementation, assuming staff and patient adoption will naturally follow. Option C. Concentrate efforts on leveraging the strong technological infrastructure to maximize patient reach, while downplaying the significance of staff training gaps and potential cybersecurity risks to avoid perceived implementation hurdles. Option D. Advocate for delaying the telehealth platform implementation until all current staff are fully proficient in existing technologies, disregarding the identified opportunity for increased patient reach. The correct answer is A. Prioritize the development of a comprehensive staff training program and a patient education initiative to address the identified weaknesses and mitigate the cybersecurity and regulatory threats, thereby capitalizing on the opportunity for increased patient reach. Explanation: this scenario is professionally challenging because healthcare planning involves balancing diverse stakeholder interests, each with unique priorities and perspectives. A certified medical planner, CMP, must navigate these competing demands while adhering to regulatory frameworks and ethical principles to ensure the optimal allocation of resources for patient care and organizational sustainability. The core challenge lies in translating broad strategic goals into actionable plans that satisfy regulatory compliance, financial viability, and the needs of patients, providers, and the community. The correct approach represents best professional practice because it systematically integrates the perspectives of all key stakeholders into the SWOT analysis. This ensures that the identified strengths, weaknesses, opportunities, and threats are comprehensive and reflect the realities faced by different groups. By prioritizing stakeholder input, the planner can develop a more robust and widely accepted strategic plan that is more likely to be successfully implemented and achieve its intended outcomes. This aligns with ethical principles of transparency, fairness, and accountability in healthcare planning, and implicitly supports regulatory requirements for evidence-based decision-making and responsible resource management. An incorrect approach that focuses solely on financial metrics without considering patient outcomes or provider capacity would fail to meet the holistic requirements of effective healthcare planning. This could lead to a plan that is financially sound but detrimental to patient care or staff morale, potentially violating ethical obligations to prioritize patient well-being and creating operational inefficiencies. Such an approach might also inadvertently contravene regulatory guidelines that mandate consideration of quality of care and access. Another incorrect approach that prioritizes only the demands of a single powerful stakeholder group, such as a dominant physician specialty or a major payer, would be ethically flawed due to its inherent bias. This could lead to resource misallocation, neglecting the needs of other patient populations or service lines, and could be seen as a failure to uphold the principle of equitable resource distribution. It also risks creating internal conflict and undermining the collaborative spirit necessary for successful strategic initiatives, potentially leading to non-compliance with regulations that promote fair access and comprehensive service provision. A third incorrect approach that neglects to consider external market trends and competitive pressures would be strategically unsound. While seemingly focused on internal capabilities, this oversight could lead to a plan that is out of sync with the evolving healthcare landscape, making the organization vulnerable to market shifts and potentially jeopardizing its long-term viability. This failure to anticipate external threats could indirectly impact the organization's ability to meet regulatory mandates for sustainability and continued service provision. The professional decision-making process for similar situations should involve a structured, multi-stakeholder engagement strategy. This begins with clearly identifying all relevant stakeholders and understanding their respective interests and concerns. The SWOT analysis should then be conducted collaboratively, using facilitated discussions and data collection methods that capture diverse viewpoints. Strategic options should be evaluated against a balanced set of criteria, including financial feasibility, clinical effectiveness, patient satisfaction, operational capacity, and regulatory compliance. Finally, the chosen plan should be communicated transparently to all stakeholders, with mechanisms for ongoing monitoring and adaptation. Question 19. Operational review demonstrates a need to conduct a comprehensive assessment of healthcare service requirements within a defined geographic region. The Certified Medical Planner, CMP, is tasked with leading this initiative. Which of the following approaches to stakeholder engagement during the needs assessment phase is most aligned with best professional practice and regulatory expectations for a robust and equitable outcome? Option A. Focus the needs assessment on analyzing existing utilization data from the past 5 years, assuming that historical trends accurately predict future healthcare service requirements without the need for direct stakeholder consultation. Option B. Primarily rely on feedback from the hospital's executive leadership team, as they possess the most comprehensive understanding of the organization's strategic priorities and resource constraints. Option C. Systematically identify all relevant stakeholder groups, including patients, physicians, nurses, hospital administrators, public health officials, and insurance providers, and develop a plan to solicit their input through a combination of surveys, focus groups, and individual interviews to ensure a broad and representative understanding of needs. Option D. Prioritize engagement with the most vocal patient advocacy groups, as their passionate representation of specific health concerns is likely to highlight the most critical unmet needs. The correct answer is C. Systematically identify all relevant stakeholder groups, including patients, physicians, nurses, hospital administrators, public health officials, and insurance providers, and develop a plan to solicit their input through a combination of surveys, focus groups, and individual interviews to ensure a broad and representative understanding of needs. Explanation. This scenario presents a professional challenge because the Certified Medical Planner, CMP, must balance the immediate need for a comprehensive needs assessment with the diverse and potentially conflicting interests of various stakeholders. Effective stakeholder engagement is crucial for ensuring the assessment is accurate, relevant, and ultimately leads to actionable plans that are accepted and implemented. The challenge lies in identifying all relevant stakeholders, understanding their perspectives and priorities, and devising a strategy to involve them meaningfully without compromising the integrity or objectivity of the assessment process. The correct approach represents best professional practice because it prioritizes a systematic and inclusive methodology for stakeholder engagement. This aligns with the ethical obligations of a CMP to conduct thorough and unbiased assessments. By actively seeking input from a broad range of stakeholders, including patients, healthcare providers, administrators, and payers, the CMP ensures that the needs assessment reflects the multifaceted realities of the healthcare landscape. This inclusive process fosters transparency, builds trust, and increases the likelihood of buy-in for subsequent planning initiatives. Regulatory frameworks for medical planning often emphasize the importance of evidence-based decision-making, which is strengthened by diverse stakeholder input. An incorrect approach that focuses solely on internal administrative feedback fails to capture the patient experience and the perspectives of frontline clinical staff, leading to a potentially incomplete or biased assessment. This neglects the ethical duty to consider the impact of medical plans on all affected parties and may violate guidelines that require a holistic understanding of healthcare needs. Another incorrect approach that relies exclusively on historical data without current stakeholder consultation risks overlooking emerging trends, technological advancements, or shifts in patient demographics and preferences. This can result in plans that are outdated or irrelevant, failing to meet current or future healthcare demands, and potentially contravening regulatory requirements for forward-looking planning. A third incorrect approach that prioritizes the opinions of the most vocal stakeholders without a structured process for gathering input from all groups can lead to a skewed assessment. This may result in plans that disproportionately benefit certain segments of the population or healthcare providers, neglecting the needs of underserved groups and failing to uphold principles of equity and fairness in healthcare planning. The professional decision-making process for similar situations should involve a structured stakeholder analysis to identify all relevant parties, followed by the development of a tailored engagement strategy that utilizes appropriate methods for gathering input from each group. This strategy should be iterative, allowing for feedback loops and adjustments as the assessment progresses. The CMP must maintain objectivity throughout the process, ensuring that all input is considered in a balanced and evidence-based manner, and that the final assessment accurately reflects the identified needs. Question 20. Assessment of the most effective decision-making framework for implementing a comprehensive medical plan for a patient with multiple chronic conditions, considering resource allocation, stakeholder coordination, and adherence to established medical planning guidelines. Option A. Prioritize immediate clinical interventions based on the most critical symptoms, deferring detailed logistical planning and stakeholder coordination until the patient's acute condition stabilizes. Option B. Focus solely on securing the most advanced medical technologies and treatments, with the expectation that logistical and coordination challenges will resolve themselves once the optimal therapeutic options are in place. Option C. Develop a detailed implementation roadmap that outlines specific patient-centered objectives, identifies all necessary resources and potential constraints, assigns clear responsibilities to each member of the care team, establishes a schedule for regular progress reviews, and includes a mechanism for adapting the plan based on ongoing patient response and feedback. Option D. Delegate the entire implementation process to the primary physician, assuming they possess all necessary expertise and resources to manage the plan independently, without further consultation or team involvement. The correct answer is C. Develop a detailed implementation roadmap that outlines specific patient-centered objectives, identifies all necessary resources and potential constraints, assigns clear responsibilities to each member of the care team, establishes a schedule for regular progress reviews, and includes a mechanism for adapting the plan based on ongoing patient response and feedback. Explanation. This scenario presents a professional challenge because the Certified Medical Planner, CMP, must balance the immediate needs of a patient with the long-term sustainability and ethical considerations of the medical plan, all within the specific regulatory framework governing medical planning. The core of the challenge lies in the decision-making process for implementing a complex treatment plan that involves multiple stakeholders and potential resource constraints. Careful judgment is required to ensure the plan is not only clinically sound, but also practically executable and compliant with all applicable regulations. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based, and collaborative implementation strategy. This involves clearly defining roles and responsibilities, establishing measurable outcomes, and incorporating a feedback mechanism for continuous evaluation and adjustment. This aligns with regulatory requirements that mandate patient-centered care, efficient resource utilization, and adherence to established medical protocols. Ethical considerations are met by ensuring transparency, informed consent, and the patient's best interests are at the forefront of every implementation step. An incorrect approach that focuses solely on immediate clinical intervention, without considering the broader implementation, logistics, and regulatory compliance, would be professionally unacceptable. This could lead to fragmented care, unmet patient needs due to logistical failures, and potential violations of regulations concerning the proper execution of medical plans. Another incorrect approach that neglects to involve key stakeholders, such as the patient, their family, and other healthcare providers, would fail to foster a cohesive care team and could result in miscommunication, duplicated efforts, or a plan that is not truly tailored to the patient's circumstances and preferences, thereby violating ethical principles of shared decision-making and patient autonomy. Furthermore, an approach that bypasses established protocols or fails to document key implementation decisions would be a direct contravention of regulatory mandates for record-keeping and adherence to approved treatment pathways, risking patient safety and legal repercussions. Professionals should employ a decision-making framework that begins with a thorough understanding of the patient's condition and goals, followed by an assessment of available resources and potential barriers. This framework should then guide the development of a detailed implementation plan that includes clear objectives, defined responsibilities, timelines, and contingency plans. Regular monitoring and evaluation are crucial to ensure the plan remains effective and adaptable, with a commitment to continuous improvement and adherence to all relevant ethical and regulatory standards.